I'm going to give you an overview of the Aspergillus galactomannan biomarker ELISA. This is a very straightforward test that can be carried out in the laboratory and is designed to pick up large cell wall components that are released from Aspergillus whilst it's growing in the patient. The test is an ELISA test, and the facilities needed by the laboratory are quite simple. A good set of pipettes, an incubator, and of course good laboratory practice. Samples are sent from the clinic or the ward, and these can be either blood samples or samples of lavage fluid that have been recovered from the lungs. Samples are processed in the laboratory and then they're added to the ELISA plate that comes with the kit for this particular assay. These are the available standard reagents available for the assay. There's an incubation step of 90 minutes, after which more reagents are added to the ELISA plate, and then the results are read in a microtetra plate reader. This then can generate printout, and the results can be interpreted, and depending on what sort of system you have in your laboratory, they can be released electronically to whoever has requested the test, or they can be telephoned to the requesting clinician. Here we have the printout from the Galactomannan reader. The template incorporates negative, threshold and a positive control. Patient samples are added in duplicate in most cases if there's enough material. And the optical density from the reader can be used to calculate an index, the level of Galactomannan in that patient's sample. And based on the strength of that signal, we can predict whether or not the patient does have invasive aspergillosis. The Aspergillus galactomannan test is rapid, it's robust, it has good specificity and sensitivity. Unfortunately, there are many reasons for false positives, which have to be explored for individual patients. Finally, it's highly recommended in recent guidelines to support the diagnosis of invasive aspergillosis.